A drug or medicine is any substance used for the treatment, relief, or prophylaxis of disease. They are obtained from vegetable, mineral, animal, and synthetic sources. They may be introduced into the body in various forms, for example, a liquid solution, in tablet form, in capsule form, and they may be administered by injection, inhalation, or absorption through the rectum and colon, for example, the Predsol retention enema and indomethacin suppositories. Through the buccal membrane, for example, glycerine trinitrate, and finally through the stomach and small intestines via the mouth. The oral route is usually the most acceptable, and whenever possible, this method is prescribed. It has been accepted that some legal control over the supply, storage, and use of drugs is necessary, and with the extensive use of new and increasingly potent drugs, close control is even more essential. Drugs in hospital, wards, and departments are given under the supervision of the ward sister, staff nurse, or clinical teacher, and a great responsibility rests on the nursing staff to ensure that there are no mistakes made. Drugs are stored and administered according to the legislation under which they are controlled. Under the Misuse of Drugs Act, Controlled Drugs Schedule 2, which are the drugs of addiction, are stored in a double locked cupboard. These must be given by 2 nurses, one of whom must be state registered. The drug must be prescribed by a doctor and recorded in a special control drug register. Poisons are stored in a separate compartment and are also given by 2 nurses, one of whom is trained. Some of these drugs are recorded at the discretion of the hospital pharmacist. Other drugs, which are in neither category, are stored in a separate cupboard. All drug cupboards are locked and the keys pinned on the trained nurse in charge of the ward or department. Drugs in current use, with the exception of the controlled drugs, are kept in the drug trolley. Which is immobilised by being chained and locked to a wall. All drugs given to patients in hospital must be prescribed by a doctor. The patient and drug sheet is identified. Drugs are given, once only and pre-medication drugs, as required prescriptions, regular prescriptions, and variable dose drugs. The prescription is read by both nurses, the drug is dispensed, given, seen to be swallowed, and recorded.